In this video, we'll be diving into a fascinating, yet complex, neurological condition: post-synaptic neuromuscular transmission defects. These disorders disrupt the crucial communication between nerves and muscles, leading to weakness and fatigue. Join us as we explore the causes, mechanisms, symptoms, diagnosis, and management of these debilitating conditions. So, what causes these communication breakdowns? Post-synaptic neuromuscular transmission defects can arise from a variety of factors. The most common culprit is autoimmune disorders, where the body's immune system mistakenly attacks components of the neuromuscular junction, specifically the acetylcholine receptors. Genetic mutations can also play a role, leading to structural or functional abnormalities in these receptors or related proteins. In rare cases, certain toxins or medications can interfere with post-synaptic function. Let's zoom in on what's actually happening at the neuromuscular junction. In a healthy individual, a nerve impulse triggers the release of acetylcholine, a neurotransmitter, from the pre-synaptic nerve terminal. Acetylcholine then diffuses across the synaptic cleft and binds to acetylcholine receptors on the postsynaptic muscle membrane. This binding opens ion channels, causing an influx of ions that depolarizes the muscle cell and initiates muscle contraction. In postsynaptic neuromuscular transmission defects, the number of available acetylcholine receptors is often reduced, or their function is impaired. This means that even with normal acetylcholine release, the muscle cell may not receive a strong enough signal to contract effectively, leading to muscle weakness. Pinning down the exact numbers is tricky, as some postsynaptic disorders are quite rare. However, the most well-known example, myasthenia gravis, affects an estimated 14 to 40 people per 100,000 in the United States. The prevalence and incidence can vary depending on geographic location and diagnostic practices. These conditions can affect individuals of all ages, though some, like myasthenia gravis, show peaks in incidence in younger women and older men. The hallmark symptom of post-synaptic neuromuscular transmission defects is muscle weakness that worsens with activity and improves with rest. This is known as fatigability. The specific muscles affected can vary. Common symptoms include drooping eyelids, ptosis, double vision, diplopia, difficulty swallowing, dysphagia, slurred speech, dysarthria, and weakness in the limbs and neck. In severe cases, respiratory muscles may be affected, leading to breathing difficulties. Diagnosing these conditions often involves a combination of clinical evaluation, neurological examination, and specialized tests. A thorough medical history focusing on fatigability and specific muscle weakness patterns is crucial. Diagnostic tests include blood tests to detect antibodies against acetylcholine receptors or other neuromuscular junction proteins. Electrophysiological studies, such as repetitive nerve stimulation and single-fiber EMG, can assess the function of the neuromuscular junction. In some cases, a tensilon test, where a short-acting cholinesterase inhibitor is administered, may be used to temporarily improve muscle strength and confirm the diagnosis. While the underlying mechanisms are similar, postsynaptic neuromuscular transmission defects can be classified based on the specific underlying cause. Myasthenia gravis, caused by antibodies targeting the acetylcholine receptor, is the most common type. Lambert-Eaton myasthenic syndrome, though primarily a pre-synaptic disorder, can have post-synaptic effects due to antibody interference. Congenital myasthenic syndromes are a group of rare genetic disorders that affect different components of the neuromuscular junction, leading to varying degrees of post-synaptic dysfunction. The primary goals of treatment and management are to improve muscle strength and reduce fatigability. Medications, such as cholinesterase inhibitors, can help increase the amount of acetylcholine available at the neuromuscular junction. Immunosuppressants, like corticosteroids and azathioprine, can suppress the autoimmune response in conditions like myasthenia gravis. In some cases, thymectomy, the surgical removal of the thymus gland, may be recommended. Plasmapheresis and intravenous immunoglobulin (IVIG) are also used to temporarily remove harmful antibodies from the blood. Unfortunately, there isn't a definitive way to prevent most post-synaptic neuromuscular transmission defects, especially those with a genetic component. However, avoiding triggers that can exacerbate symptoms, such as certain medications or infections, is important. Early diagnosis and treatment are crucial for minimizing disease progression and improving quality of life. Public awareness and genetic counseling may be beneficial for families with a history of congenital myasthenic syndromes. The prognosis for individuals with post-synaptic neuromuscular transmission defects varies depending on the specific condition, its severity, and the effectiveness of treatment. With appropriate management, many individuals can lead relatively normal lives. However, some may experience persistent weakness and functional limitations. Recent research is focused on developing more targeted therapies, such as monoclonal antibodies that selectively block the harmful antibodies, and gene therapy approaches for congenital myasthenic syndromes. Continued research holds promise for improving the lives of individuals affected by these challenging disorders. Thank you for watching.